Let's now move to the Western Cape, where security at hospitals and clinics is a real worry. In just 3 months, that's between April and June this year, there were 92 physical assaults at provincial facilities. Our reporter Monique Mortlock joins us from our Cape Town studio. So, Monique, we know that there have been problems, particularly in gangland areas. 92 physical assaults. First of all, talk to us about the nature of the assaults and if Hospersa told you whether the incidence of violence within hospitals is actually worsening.
When you are looking at the statistics, the latest statistics, comparing them to last year, there's definitely been an increase in the number of apologies, Sally.
No
in the
problem
number
at all.
of
I tell you what we're going to do, Monique.
incidents.
I know that you have actually spoken to healthcare
Yes.
workers. I'm going to allow you to clear your throat. Let's just throw to those healthcare workers, because I know you asked them what they're experiencing, and then we'll come back and you can give us some context. Let's play that clip first.
So one of our members' great concerns is reporting issues, issues of physical assault, physical abuse. Main reason is they feel that there's no sympathy being shown from a management side. Management requests members to say, what do they want the management to do? We are saying that's unacceptable because it's the employer's duty, first of all, to provide a safe working environment. Now, if members are not even feeling safe in their own workspace, how does the department, expect them to deliver the service to the best of their ability?
All right, so clearly some concerns from the union about the way the department is managing this. But first of all, you were telling us about the difference between this year and last year, 92 physical assaults in a 3-month period this year. How does that compare to the same sort of period last year? And are we talking about an unruly patient that perhaps slaps a healthcare worker, or are we talking about serious life-threatening issues?
We are talking about all of the above, Sally. In fact, earlier this month, on the 8th of September, a patient actually attacked another patient at Karl Bremer Hospital. This is one of the biggest state hospitals here in the Western Cape. And the patient then succumbed to their injuries and passed away. I then visited Karl Bremer Hospital today to do a bit of a test on its security measures. Now, when you enter the facility or the property, they inspect your car, they scan your driver's license. I then tried to see if I could enter the hospital with a weapon. I used a screwdriver, I put it in my bag. I didn't even have to really conceal it, because when I arrived at the visitor's entrance, even though it wasn't visiting hours, I asked the security officer if I could go inside just to use the bathroom. The security officer allowed me to enter without even checking my bag. I even offered to show my bag. I said, don't you need to check my bag? They let me in without checking my bag. I managed to go into the bathroom, do a bit of a walk around with the screwdriver in my bag. And I asked the health department about this. I told them exactly what I did. And Dr. Anwar Karwa, he told me that this type of feedback, incidents like this one, these are just one of the things that they look at during their monthly review, security review meetings. And this incident that I described to him, or my security test today, is one of the incidents that they will be taking on review and discussing with the management at Karl Bremer Hospital. And Dr. Karwa was saying that incidents like patient-on-patient attacks, they are often out of the control of security guards at hospitals, because often when they happen, they take place unexpectedly, and they will take place either during quiet hours when staff have maybe already done their rounds and are moving in between shifts, and it's then that criminals will then attempt to conduct whatever violent activities they want to do. There's also the issue of facilities that are in certain geographical locations, and this is also something Dr. Karwa spoke about, where they said that each facility, depending on which area they are in, for example, Hospersa's Monique Mortlock. I spoke to her in Hanover Park. That's where she lives. And she says that Hanover Park is one of those dangerous areas, those hotspot areas, where it's even dangerous for staff members to travel to and from work. And Hospersa is calling on the health department to also look at the safety of staff members walking to and from work or traveling to and from work, because the same people who often are the perpetrators of assaults or robberies while the staff are traveling to and from work, these are the same people that staff members have to help. But let's just take a listen to Dr. Karwa explaining what the department is doing.
The department has taken a multi-pronged approach to prevent criminal incidents from occurring at our facilities. Monique, we need to be mindful that a health facility is a place where people go for medical care and should not be seen as a place for criminality. So we are concerned, but this particular challenge is receiving our close attention.
Yeah, I mean, I'm not hearing a very strong response there. You were starting to tell us about whether the problem of security is getting worse year on year. Is it worsening?
Well, this year compared to last year, it definitely has. And this is something I asked Dr. Karwa about, because when you're looking at the stats from January to June this year and compared to last year, it's quite alarming when you see that in 1 month, for example, it went up from 74 incidents last year, this is just in 1 month, to 117 assaults or incidents of assault. And we're talking verbal assaults, physical assaults, patient on patient, patient on staff member, even staff member on staff member. But the most common incident is patient on patient. And the department made it clear that while it's doing its best to ensure that its security measures are intact when it comes to access control and perimeter checks, it can't really do much when it comes to criminal elements from the community coming in and doing doing some criminal activities, especially in those areas like your gang-ridden areas, like your areas like Hanover Park, where staff members are often facing attack even while just making their way to and from the facilities. But one thing Hospersa is asking for is for unions to be involved in discussions, in security discussions, because they represent thousands of health workers across the Western Cape. And they are saying, we are speaking to health workers every single day. Every day we are hearing about complaints where health workers feel intimidated. They feel they can't speak to management to relay concerns or even to say they've been verbally abused or physically harmed by a patient or by a fellow staff member, because they feel they can't trust management and they feel that their issues don't get taken seriously. And this is why Hospersa wants to be part of the discussions. They want to engage with the department when they are discussing ways in which to improve security systems at facilities.
Yeah, and I mean, you've just given us the 1 month, and it's obviously verbal and physical, but 1 month of last year, 74, and 1 month of this year, 117. So the problem is clearly worsening. And as you explained so well, you were able to enter a health facility with a screwdriver in your bag, and no one bothered to check. So, important issue. Thank you very much. eNCA reporter Monique Mortlock coming to us from Cape Town.